succinct, short. Postulate, claim. Taciturn, reserved. Taciturn, reserved. Chide, scold. Chide, scold, consternation. Concern, anxiety. Languid, sluggish. Languid, sluggish. Illustrious, eminent. Illustrious, eminent, eminent. Incongruent, incompatible. Superfluous, unnecessary. Obstinate, stubborn. Obstinate, stubborn. Proximal, central. Anastomosis, connection. Cauterize, burn. Incision, cut. Diagnosis, explanation. Salpingo, a tube. Cystoscopy, examination of bladder. Biopsy, remove for observation. Deficiency, absence. Benign, harmless. Dichotomy, division. Acute, sudden. Intense, sinuous. Supple, supple. Bifurcate, divide. Bifurcate, divide. Occlude, to close completely. Innervate, weaken. Debilitate, lacking strength. Palpated, to examine by touch. Anterior, frontal. Adhere, hold fast or stick together. Adverse, undesired, possibly harmful. Compensatory, making up for something. Complication, undesired problem. Comply, do as directed. Concave, rounded inward. Concise, brief, to the point. Consistency, degree of viscosity, how thick it is. Constrict, to draw together or become smaller. Contingent, dependent. Contour, shape or outline of a shape. Contract, to draw together, to reduce in size. Contraindications, a reason why something is not advisable or why it should not be done. Defecate, expel feces. Deficit, deficiency or lack of something. Depress, press downward. Depth, downward measurement from a surface. Deteriorating, worsening. Device, tool or piece of equipment. Diagnosis, identification. Diameter, the distance across the center for an object. Dilate, to enlarge or expand. Dilute, to make a liquid less concentrated. Discrete, distinct, separate. Distended, enlarged or expanded from pressure. Dysfunction, impaired or abnormal functioning. Elevate, to lift or place in a higher position. Endogenous, produced within the body. Exacerbate, to make worse or more severe. Excess, more than what is needed or usual. Exogenous, produced outside the body. Expand, to increase in size or amount. Exposure, contact. External, located outside the body. Fatal, resulting to death. Fatigue, extreme tiredness, exhaustion. Flaccid, limp, lacking tone. Flushed, reddened or ruddy appearance. Gaping, wide open. Gastrointestinal, stomach and the intestines. Gender, sex. Hematologic, blood. Hydration, body fluid balance. Hygiene, measures contributing to cleanliness and good health. Impaired, diminished or lacking some usual quality or level. Impending, likely to occur soon. Incidence, occurrence. Infection, contamination or invasion of body tissue by pathogenic organisms, inflamed, reddened, swollen, war, ingest. Sallow for digestion. Initiate. To begin or put into practice, insidious. So gradual as to not become apparent for a long time. Intact. In place, unharmed. Intact. In place, unharmed. Internal. Located within the body. Internal. Located within the body. Invasive. Inserting or entering into a body part. Invasive. Label. Changing rapidly and often. Label. Changing rapidly and often. Laceration. Cut. Tear. Latent. Present but not active or visible. Lethargic. Difficult to arouse. Manifestation. An indication or sign of a condition. Musculoskeletal. Of or relating to muscle and skeleton. Neurologic. Relating to the nervous system. Neurovascular. Relating to the nervous system and blood vessels. Nutrient. Substance or ingredient that provides nourishment. Occluded. Closed or obstructed. Ominous. Significantly important and dangerous, ongoing. Continuous. Oral. Given by mouth. Overt. Obvious, easily observed. Parameter. A characteristic or constant factor. Limit. Paroxysmal. Beginning suddenly or abruptly. Convulsive. Patent. Open. Pathogenic. Causing or able to cause disease. Pathology. Processes, causes and effects of a disease. At posterior. Located behind, in the back. Potent. Producing a strong effect. Potential. Capable of occurring or likely to occur. Precipitous. Rapid, uncontrolled. Precaution. Preventive measure.